Many factors contribute to the correct calculations of a prescribed dosage for patients. If a calculation error occurs and the patient is given the wrong dosage, the treatment will either not work or the treatment will cause harm to the patient. It is very important to give the right dosage every time, but accidents can happen. Many things have to be taken into account when giving patient a medicine. A pharmacist or nurse will have to use the patient's medical information such as age, body weight, severity of disease and health and nutrition, tolerance and allergy. The kidneys and the liver is where the drug will be filtered out. The kidney and the liver work together to get rid of any toxic waste that is in the body. If the patient's kidney is weak, then the toxicity of the patient will rise because the organ cannot process the drug fast enough before another dosage is taken.
Shipwreck in a sea of faces, there's a dreamy world up there. Dear friends in higher places, carry me away from here.
If the patient's health are not taken into consideration in their calculations, this could happen. For example, if the antibiotic for a bacterial infection that a patient is being treated for is insufficient, the infection might not be treated properly and the patient's health won't improve. Also, the bacteria can develop resistances to these drugs if not given the proper dose. This can affect society as it will limit the drugs available to treat certain infections. Another example would be in the use of chemotherapy to treat certain cancers. If the correct dose is not calculated based on the patient's specific characteristics, the tumor will not be treated effectively and the cancer could spread and ultimately affect the patient's lifespan. Similarly, if the dose calculated for the chemo is too high, it may not only affect the tumor but other healthy cells. That could cause disastrous consequences to the patient's health. If a medical error consists of a dosage being too low, the medicine will not help. Medical errors are extremely costly for everyone because if something is wrong, there will be more trips to the doctor, the walk-in clinics, the hospital, and the emergency rooms. It is very important to do everything we can, and it all starts with the correct calculation. Many other errors can be made too, such as medicines names that sound the same, or even stating the wrong characteristics of a patient. An inaccurate calculation can cause an overprescribed dosage or an underprescribed dosage, which can lead to dangerous results. In 2014 in Canada, it was said that medical errors cause 9,000 to 24,000 deaths a year. These deaths can be preventable if we gather all the information and do the calculations right. A saline solution is made up of salt and water. It is used for a wide range of things such as eye drops, cleaning wounds, and helping in the survival of a patient who has been in an accident. If the saline solution does not have the same concentration or saltiness as the bloodstream, it can cause harm to the patient. Whenever you introduce fluids through an IV, you usually want to use an isotonic solution. An isotonic solution is one that has about the same ratio of solvent to solvent that is similar to the ratio seen in blood. The percent of salt in our bloodstream is around 0.9% by weight. Even a small change can lead to bodily changes. In order for a saline solution to be effective in health matters, the doctor, nurse, or surgeon will have to make sure the solution is about 0.9% salt, so that it is compatible with the body's blood. The saline solution can be used to replace fluid losses if somebody is dehydrated or cannot replace their own liquids, or if they have a sudden blood loss for some reason. In this way, the 0.9% saline solution helps to maintain a balance of the osmotic pressure between the body cells and the fluid. If you were to use a hypertonic solution, you would draw water out from your blood cells by osmosis, causing them to shrink. This could be very dangerous in certain situations. One situation it might be helpful in would be in a traumatic brain injury. In this case, after head injuries, the brain cells swell. As the brain is in the enclosed space, the pressure rises and can cause significant health risk or death. If you give a hypertonic solution, fluid is pulled out of the tissue and brain, thereby shrinking the swelling. If you use a hypotonic solution, it would cause water to rush into the blood cells to dilute the contents to try to reach equilibrium, causing the cells to swell and or burst, causing significant problems. For example, if you lost blood and were just given distilled water, your blood cells would potentially burst. Since they carry hemoglobin, your oxygen levels would drop and you could die. It is extremely important to use correct calculations when dealing with saline solutions for patients. The healthy recommended intake of salt for the average Canadian is 1,300 milligrams per day. But Canadians eat about 3,400 milligrams of salt each day. That is more than double the amount we need. An intake of 2,300 milligrams of salt is considered a risk. Our bodies need sodium, but too much of it can lead to serious health conditions such as high blood pressure, at risk of a stroke, heart disease, and kidney disease. When you consume too much salt, you can develop high blood pressure because the concentration of the salt in your blood is too high for the kidneys to get rid of the water. The kidneys do not want to make the blood more concentrated, so they only get rid of some of the water. When there is more water in the blood vessels, the blood pressure becomes high because it can't go through the kidneys. High blood pressure can cause damage to arteries and can lead to strokes and heart attacks. About 80% of the salt that people consume comes from the processed food that they eat. The 20% comes from cooking. One way to avoid going over the daily recommended salt intake is to watch what you are buying in the grocery stores. You have to look at the labels to make sure that you are not going to eat an excess amount of salt. Try to eat more fruits and vegetables, fresh grains, and avoid processed foods. Also, make sure the serving sizes are the right size for you. Salt is essential to our bodies, but we need to balance it. If we watch our salt consumption, we can significantly reduce the harmful effects of too much salt.